Let's talk about something that most men won't, and most people don't really understand. Erectile dysfunction that starts in your mind, not in your body. We've been told that ED is mostly about blood flow, testosterone, or age. But for men between 20 and 40, the majority of ED cases are not caused by physical issues at all. Hormones, normal. Circulation, totally fine. But still, things are not working the way that they should. So what is going on? The answer lies in your mind. In other words, your thoughts, your beliefs, your feelings, the hidden tension that you carry into the bedroom without even realizing it. You might be thinking, so what? Let me just take a pill. It might actually surprise you to hear that as a therapist, I sometimes recommend ED medication even when I know the root cause is psychological. Why? Because sometimes one boosted experience of success can interrupt the cycle of doubt and shame. But if you want lasting change, you have to go deeper. In this video, I will walk you through the 7 most common psychological causes of ED and how to start shifting them now. My name is Mark Goldberg, and I'm a certified sex therapist who works with men like you every day to untangle the emotional, cognitive, and relational causes of sexual dysfunction. I founded eiqmen.com, a platform dedicated to helping men like you rebuild sexual confidence from the inside out, not through performance pressure or empty advice, but through podcasts with experts, coaching, and our one-of-a-kind self-guided courses designed to empower you to take control of your sexual health and wellness. If you are here, you probably want more than a quick fix. You want clarity. You want relief. You want your confidence back. And it starts with understanding why your body might be saying no exactly in the moments that your mind wants to be saying yes. Let's walk through 7 hidden reasons that your mind might be interfering with your sexual performance. Number 1. Avoidance of intimacy. You want sex. You may crave it. For a lot of men, ED is not about a lack of desire. It is about what partnered sexual activity can stir up: vulnerability, exposure, and the fear of being fully seen. When intimacy feels risky, your body often reacts before you realize what's happening. Number 2, you are overstimulated everywhere except during sex. Most men are constantly exposed to high levels of stimulation, whether it's fast-paced work environments, social media, constant notifications, or hours of streaming content. Your brain gets trained to expect intense input, instant novelty, quick feedback, and dopamine on demand. So when sex asks you to slow down, stay present, and connect emotionally, your nervous system can feel underwhelmed or even disinterested. For some men, that overstimulation includes regular use of pornography, which conditions the brain to expect high-intensity visual and psychological stimulation. The result? Real sex can feel muted, quiet, not enough to activate your arousal system. And if your brain does not register the experience as stimulating, or if it is too anxious to stay engaged, your erections will follow that lead. This is not about desire. It's about contrast. And if your everyday life is more stimulating than your sex life, your body may not respond the way that you want it to. Number 3, negative sexual memories or embarrassment. One awkward moment, one time you lost your erection, one partner who made you feel inadequate. Those moments can stick. They teach your brain to associate sex with fear, pressure, and failure. That anticipation, that dread of it happening again, builds anxiety. And anxiety shuts down the very systems required for arousal and for gaining an erection. Many men are stuck in a loop they don't even realize they are in. Number 4, shame or guilt that has not been processed. Shame is a powerful emotion. It may come from religion, early upbringing, or cultural ideas about sex and masculinity. It hides in the background until you try to experience pleasure or connection. That is when it surfaces. For many men, ED is not about a lack of desire. It is the nervous system saying, this feels wrong, even if you consciously want it. Until that shame is addressed, your body may keep reinforcing the idea that arousal is not safe. Number 5. Body image and self-perception. Men are rarely allowed to admit this, but body image affects performance. If you do not feel desirable, if you are carrying doubt, insecurity, or comparison, it is difficult to trust that your partner truly wants you. That self-doubt undermines confidence, which undermines arousal. Your body reflects what you believe about yourself. And if that belief is, I am not enough, your sexual performance will follow suit. Number 6, fear of consequences, including sexually transmitted infections or pregnancy. You may not be thinking about this in the moment, but the anxiety is still running in the background. Fear of getting someone pregnant, fear of contracting a disease. Your conscious mind may dismiss it, but your nervous system does not. If sex feels risky in any way, your body will often respond by hitting the brakes without consulting you first. Number 7, emotional disconnection in your relationship. You may not be arguing, you may not even feel unhappy, but something feels off. The spark has dimmed. The emotional connection is weaker than it used to be. Your nervous system is picking up on this. It senses absence, tension, boredom, or unspoken resentment. It sends a message. This does not feel safe or exciting or open. That message turns into withdrawal. physically, emotionally, and sexually. ED medication may help you in the short term, and for some men, it can provide that needed boost of confidence. But if the cause is psychological, medication alone will rarely resolve the problem. It may bypass the symptom, but it will not heal the underlying patterns. Real resolution happens when you identify the source, retrain your psychological patterns, and build a relationship with yourself that is rooted in confidence, not pressure. If that is the path you want, if you are ready to stop managing symptoms and start building lasting sexual confidence, then please visit eiqmen.com. You will find expert-guided courses, coaching, and tools to help you shift the psychological patterns that are keeping you stuck. You are not alone in this, and you are not broken. You simply need a different approach, and we are here to help you find it.